Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back.
And if you're joining us now, we're getting our first conversation for this morning started. As we said before the break, we are going to be talking all about Pharmacy Week. And we've got two pharmacists joining us to talk about the significance of and the importance of Pharmacy Week 2021. So joining us via Zoom, we have Hortence, who is a senior pharmacist at the Central Health Region, as well as Irma Sanchez, who is the pharmacist in charge of the San Ignacio Community Hospital. Good morning, ladies.
Good morning.
And thank you very much for joining us. We'd like to take the opportunity to celebrate Pharmacy Week with you all and to educate some of our viewers about the week and about the work that you do. Perhaps Hortence, we can start with you. And can you just talk a little bit about the significance of Pharmacy Week to you?
Hi, good morning, everyone.
Yeah.
Pharmacy Week have always been important to us as a profession. It highlights us as we have always been in the background as a frontline worker. And it brings us more to the forefront to know what our work is, to come out there to the people and show them. We have been doing health fairs and doing health activities for our colleagues, and for us to be recognized both national and international as a profession.
Yeah.
So we have, to the beginning, Pharmacy Week for us was in June, and later on we changed it internationally for the 25th of September. That's when we started to celebrate Pharmacy Week in Belize.
So, and we also have with us Irma.
Yes, good morning.
Okay. Irma, tell me about what made you decide to be a pharmacist.
I have always liked the study of medicine. I always liked chemistry as a young student. And I always enjoyed the molecular formulas and looking at structures.
Mm.
And I also knew that I wanted to do something to help my community. Any field that you take in medicine is a call. You know, it has to be that you are passionate about what you will do when you're dealing with patient care.
Yeah.
I know for a fact that nursing wasn't for me. It wasn't something that interested me.
Yeah.
But I like the study of medicine.
Mm-hmm.
And so I did pharmacy because we know how important pharmacy is as part of the chain in healthcare. None of the professions in pharmacy, in medicine, we're not competing against each other. Actually, we complement each other because the delivery of health services is a multidisciplinary approach. You need the doctor, you need the nurse, you need the pharmacist, you need the X-ray technician, you need the laboratory technologist to have that holistic approach and ensure that the patient gets the best care.
Yeah.
In the past, pharmacy, and even up to present, pharmacy has been like the profession, the silent profession.
Mm-hmm.
A lot of people see the one component of pharmacy care, which is the dispensing, the actual counting of the tablets, the packaging. That's only one component of dispensing.
Yeah.
You know, when a pharmacist reaches that point of dispensing that medication, we have already done the prescription assessment. We have to look for drug interactions. We have to look for dosages. We have to look at what condition the doctor is treating to see if that is the best option or if we can make a recommendation to use something else. Mm-hmm. So that is where we play a very key role, but always behind the scenes. And that is what the public doesn't get to see.
Yeah.
So for us, celebrating World Pharmacy Day on September 25th is an opportunity to highlight us as professionals and highlight the profession, because pharmacy is central to the delivery of healthcare services.
You know, Irma, I think you missed one crucial skill, I think, which all pharmacists have, which you didn't mention, and that's reading doctors' handwriting, which I don't...
Well, it has been a little easier with us in the hospital services, because we now we use the Belize Health Information Services, which is an electronic technology. But yes, we also have to ensure that we know how to read the manual prescriptions.
I always wondered if there was a class on that, but I guess you developed the skill with time.
I believe that because we're so familiar with all the different pharmaceutical products,
Yeah.
and then we look at what condition the doctor is treating. So when we see a prescription, even if maybe we can't decipher the scribblings right away, but we are able to tell what the medication is.
Yeah. I think you mentioned, and it's a continuum of care that we receive in the healthcare system. And you are absolutely right. The pharmacist plays such a critical role in multiple ways. When you interface with a patient, you also are a part of their education process. You talk to them about how to take their meds, what they can and can't do. But my question has to do with looking at the profession in the country. A few years ago, there had to be a crackdown on pharmacies because people were opening pharmacies and not having a licensed pharmacist in the institution. In other words, someone who wasn't trained to dispense medicine was dispensing medicine. So let's talk about some of the challenges that you know about this profession in Belize, and things that the public needs to be aware of when they do step foot into a pharmacy.
Well, to start with, I need to emphasize that pharmacy is a legally regulated profession.
Yes.
We are governed by the Chemists and Druggists Act, which is Chapter 311 of the laws of Belize. One of the challenges that we face is, one, our legislation is outdated. We have to agree with that. We have been making recommendations, and hopefully we can table an updated pharmacy law very soon. But also that the public also has to know that any establishment must have a registered licensed pharmacist in order to be able to dispense a prescription, give health advice, and especially because the medication is our area of expertise in terms of drug interactions, the method of use, the dosage, what will be the outcome, the possible side effects. It is important that the public also learns to demand what is good for them. You understand? Not just walk into any establishment. And that brings me to the topic of the theme for this year, which is pharmacy always trusted for your health. And so if we talk about trust, trust is probably the most essential component in any relationship. So we're talking about trust between the patient and the pharmacist, which is a relationship that you develop. Trust between the pharmacist and the doctor. Trust between the pharmacist and the nursing staff. And trust between the pharmacist and all the other non-technical staff that works around us. So what does trust really mean in that aspect? For me, what it brings to mind is that I have to be very well knowledgeable of what I am going to counsel a patient on. I have to do my research, and it has to be scientific research, not just any Google document. You know, it has to be real scientific based data that we research, that we can advise our patients on. And when I develop that relationship with the patient, is because I have proven that the patient can trust me, that when I tell them, you may expect this, or this is the best way to take it, and for that period of time, is because I have done my research and I'm looking for the best outcome for the patient. And likewise, we do intervene when sometimes we detect maybe we do have everybody that is just fresh out of school, whether it be a doctor, a nurse, a pharmacist, does need that coaching from more experienced people in the profession.
Yeah.
And we do detect sometimes dosages are not what they should be. Maybe the doctor overlooked that these medications may interact. And that is where we develop that trust rapport between the doctor and the pharmacist, because then the doctor knows, you know what, this pharmacist will not let me commit an error. And then they go back, and they go back.
Yeah.
And afterwards, it moves to another level. It's not just an intervention, it's actually a discussion. Let's discuss the patient's therapy. I want your input. And that's the kind of relationship you develop because they learn to trust you.
Yeah.
Right. And Hortence, earlier on, you had used the term frontline workers in reference to the work that you pharmacists do. And that, of course, brought up in my mind, of course, the pandemic. And I'm wondering how, if in any ways, the pandemic did influence or change your profession and what you've had to deal with over the past 2 years. So, Hortence, can you talk a little bit about COVID-19 and how it's influenced your job and the profession as a whole?
Well, as frontline workers for the COVID, we have taken not only our normal role of having our medications, have our in stock on hand, but also we have taken the different roles of assisting our other staff in going out in the fields with them to do the vaccination, to do the COVID testing. Our production lines have increased because here at Central Region, we manufacture both nationally and we have the other frontline workers out there, the police, the BDF, our security force, who have asked us for our assistance in the manufacturing of the hand sanitizer, the alcohol, for them to feel safe.
Oh.
Our role in the election process, we have been involved with elections, but due to the pandemic, we had to supply them with the hand sanitizers so that when they go, our other public officers go there, they're safe. Having the inventory for them to use, the supplies, the PPEs, our gowns, the goggles, the N95 or face masks, have the swabs them, and we monitor those and we distribute those. So those have been thrown on us as pharmacists, and we are very good at our inventory control and make sure supplies are there. That's one of the key things behind pharmacy, as in when we just dispense medication, just as we dispense, we have to make sure that we know our usage rate. We have the supply in stock. We know where to get our supplies, and we have those available. So as our other colleagues comes, our other healthcare, other frontline workers come, they say, we need this. We have it there to give them. So they know that they can come to pharmacy, trust us that we have the supplies and we will get it for them. So
Yeah.
for that role as pharmacists in the frontline work, as frontline workers, for the vaccine process, we pre-pack those medications that people get for the thousands of people who have get vaccines.
Yeah, you're right.
Behind the scene packing those medications, and it's not easy. We have to get labels, we have to get those medications and pre-pack, have those available for those packages that the COVID patient have. Pharmacy are behind the scene having those zinc, those ORS, those Tylenol, those ibuprofen, those Benadryl, those B-complex, those multivitamins there in those packets. And it's like we're there, and we pack. Some days we pack up to 18,000 a day, and by the blink of an eye, the staff come in and said, "I need this. I have to have this." We're doing a lot of multitasking with our staff, because we still have to continue our normal duties. We still have to manufacture. We still have to tend to our patients, the NCD's patients at Central Regions. Our facilities are far apart, so we have to find transportation to take these to our medication to San Pedro, to Kikaka, to Ladyville, to Hattieville, to Port, to Matron Roberts, to Cleopatra. And I must say the staff here, even if they said the data entry clerk said, I will come on my bike to pick it up so that I can have it for the patient.
Yeah.
Everybody have worked together as a team.
I'm so glad you said that, Hortense, because I think that's one of the things that a lot of people don't know, which is that for persons who are registered with public clinics, that you've actually been dispensing their medication, people who have NCDs, and sometimes even taking it to them so they don't have to expose themselves to unnecessary risks by coming to the clinic. And these are kind of the extra efforts that are made by our healthcare system to try to keep everyone safe. But let me come back to something else that you said before. You said you need to understand the usage history. In other words, you need to know what type of supply you need to have to meet demands. What has changed under the pandemic when it comes to supply and demand for common medications?
For the COVID medications, we have seen increased usage in our Tylenol, our Brufen, our zinc, the vitamins and all of those things. So it's like one spell when we're requisitioned for those, it takes quite we've been requisitioning for it like while normally we would have said, okay, I need like 36,000 ibuprofen. Now it's like 18,000 in a case. We wanted like 20 case of that, and we would normally requisition like 3 case, 20 case. So those things there, we see where there is an increase. Then we have to find storage space for them. So all of these are behind the scenes that we do our and these are reports that pharmacy gives out, because we have to record. Once we use it, we have to do recording to say, okay, we're using these meds, where it is going, and all of that with our COVID testing. Pharmacy have taken, here at Central Region, we have taken on that role of having it and supplying it to the nurse. That wasn't part of our responsibility before. That was more like the lab. They would go to the lab for it, but then even the lab overwork, and when they need it, the nurses and the doctors, they need it like immediately, and the lab don't have time to attend to them because they have all those testing to do also. And because pharmacy, we're here as a constant for us. We're here, they can come to our office and say, we need this, and we tell them the process. If they don't know the process, we assist them in the requisition of it and keep documentation of it.
Take us back, if you or Irma could share with us just what the COVID care package includes. I know there's a medication packet that you give to people when they test positive.
I would like to add to that. With regards to the functions during COVID, the dynamics of everything has changed. And yes, pharmacists are responsible for the supply chain management. And that forecast that we do once a year is a humongous responsibility, because you have to look at all your medications. You have to look at what all has been used for the year, how many patients you had on certain treatments. And then you have to forecast what you will see, what you perceive to be your usage for the following year. And that's how we make recommendations to the Ministry of Health, so that when they then engage into the tender contract, they would know how much medications to purchase for the country. In addition to what Ms. Hortence had mentioned, at the hospital level, which is different than the health centers, pharmacists are also responsible for the oxygen supply, which is crucial to the survival of COVID patients. So we have to be right on top of things to monitor oxygen usage. We have to constantly check at the flu clinic how many patients are on oxygen, and then on how many liters, and then we have to calculate how much our stock will last us before we contact Fabregas for another delivery. With regards to the medication packages, if a patient is only symptomatic, mildly symptomatic, that package would include a little bottle of Benadryl or Misexpect. It would include an antihistamine for either runny nose or any allergy. It includes Tylenol or ibuprofen for fever or pain. Now, when a patient becomes moderately symptomatic, they're reaching the point of hospitalization, that continuum of care changes. The packages are no longer given to them. Then they're monitored as inpatients. So we also have to be monitoring how many patients are admitted to ensure that we supply the flu clinic daily drug charts for those patients. So pharmacy, our responsibility has increased exponentially. With regards to the vaccines, we are part of the vaccination campaign. I know personally here at San Ignacio Hospital, NEMO has relied a lot on us to do the training for their desensitization, for their teams, for their rescue teams, especially trying to persuade them to get the vaccine. And again, it leads us to the issue of trust, because when they rely on us that we're providing the right information to them, then they're more prone to be receptive to getting the vaccination. So that has changed the dynamics a bit, where we engage a lot with the community and not just being behind the window attending to patients on a one-on-one.
Yeah.
Pharmacy really does a lot.
Yeah. No, you definitely do. And I wanted to move, if we could, very quickly just off COVID for a moment and talk about some of the other areas of potential harm when it comes to self-medicating. And what's the association doing, since you have been formalizing yourself, looking at things like overuse of antibiotics or providing prescription medication without prescription, some of the things that you know can really harm the society, or having stores sell medication that don't even have English labels, that people don't know what's in them or how to take them.
I believe that our association, we need to activate and reactivate. We have not been very active as an association. Yeah. And also because COVID has changed the dynamics of things. But it is a risk to the community, which brings me to the point of, let us not forget our community pharmacists.
Yes.
People in the private sector, they are first contact for the patient, sometimes before they even reach the hospital. That's right. Or if they want to see a doctor. So I also want to salute my community pharmacist colleagues out there. It is important to know that we rely heavily on them to ensure that they do the ethical thing. I mean, pharmacists do not diagnose and we do not prescribe. Pharmacists are trained to treat based on diagnosis done by the physicians. And based on that diagnosis, then we know what is the most appropriate medication that they're supposed to take. Now, there is something called a pharmacist sale-only medication, which is not necessarily over-the-counter, but is also not necessarily strictly prescription. Those are the ones that the pharmacist in the community setting can recommend to patients based on symptoms, signs and symptoms presented or described to them. But if it is a strictly prescription medication, for example, a pharmacist should not be starting a patient on diabetic treatment, hypertensive treatment. Those need management until a person reaches the dose. The appropriate dose is what we call the maintenance dose. So that person will need to make several visits to the clinic to ensure that they have reached they have arrived at the dose where they will be maintained properly, whether it be diabetes, hypertension, any cardiac condition. So pharmacists should not be giving patients medication for those without a valid physician's prescription. We go back to the issue of antibiotics. And one of our biggest challenge is the supermarkets. Yes, we don't have the personnel for enforcing the policing that is necessary within the inspectorate unit, but hopefully that can also be improved.
Yeah.
Because, and it takes me back, Ms. Marlene, to the issue of also the public asking for what is best for them. They should not just walk into a supermarket and take any medication off the shelf because they don't know how it will interact with probably what they're taking. And also that you have to realize that pharmacists and pharmacists have to maintain temperature control of all these medications, which several supermarkets do not have. So the public also has to want better for themselves and go to where there is a licensed pharmacist and ensure that you will get exactly what is right for you for the condition that you're presented.
Yeah.
And also with the antibiotics and medications out there, we have our drug inspector units, just as how pharmacists, we police the doctors in where they check and balance with when they write their medication to see that everything, their diagnosis, their treatments, everything's are in order. The drug inspector out there, that's another department in pharmacy that they go out there and inspect us, the community pharmacy. They come and inspect us as pharmacists in any working area, that our areas are kept according to standards, our dangerous drug books are up to standards, that we dispense in it according to the regulations, our antibiotics, that they have prescription for them. So they do go out there. So it's not just that the pharmacists are left there on their own. The government have a body out there, the drug inspectors, that who goes and regulate those.
On what's being sold. What's being sold to the public. What about when there are wild claims made of medications that may cure things that don't exist? Who regulates that? Where does the Pharmacy Association fall into that?
The regulatory body for pharmacy practice in Belize, whether it's community or hospital, is the Ministry of Health. That is the competent authority. The Pharmacists Association in its current state does not have that legal arm or legal authority to police anyone in that sense. It's more of just a professional association, like a networking. But it can influence the ministry in terms of ensuring that these medications out there with all these bogus claims are also regulated. So that also falls under the Ministry of Health.
And in a similar sort of topic, earlier on in the introduction of our show, we were talking about the issue of the COVID-19 vaccine and vaccine hesitancy. And I'm wondering if you, as pharmacists, ever deal with this issue, not necessarily just related to the vaccine, but sort of hesitancy, and perhaps persons may have questions of the pharmacy, of you all, as to, the safety of the medications. And if you are in that position, how is it that you've been able to perhaps, allay some of their concerns or give any advice that might be helpful to anybody who is maybe doubtful or anxious about taking certain types of medication?
It goes back to your years of service, of interaction with the public. Generally, in the past, Pharmacy Day has been a week whereby we would set aside an entire week, and it was done in June. But now, because World Pharmacy Day is in September, we decided to go as a profession to celebrate International Pharmacy Day. But we would normally do health fairs. We would also do what we call the brown bag day, where the patients are encouraged to bring all their medications in a brown bag. We would sort them out for them. We would get rid of what's expired. We would counsel them. We would ask them how the medication has been stored and for how long has this bottle been open, because everything has a shelf life. And so when you develop that relationship with your patient and they have questions about anything else, we find that we are readily able to allay their fears when they have concerns. For example, a patient may come to us and say, this tablet disintegrates too fast when I take it out of the blister. Maybe it crumbles in their hand, And so we assure them that we do what we pharmacists also do what we call a quality assurance product card. So we help the ministry in monitoring the quality of the drugs that we have at the end user point. And so we would show them that we would make a report to the ministry, and it would be followed up, and the drug will be investigated to see if there's anything with the compression of the tablet, and to ensure that the quality has not been compromised. So we are able to deal with patients in that sense, because we show them where we network with the ministry and with the other pharmacist colleagues countrywide. And if it's something that they're not comfortable with, they may say, well, this looks discolored or this breaks. We say, well, we'll try to get you from another institution to see if there's a difference. So we do one-on-one with the patients like that to allay their fears.
Okay. Well, we are just almost out of time.
Yeah.
So before we go, are there any final messages that you'd like to send to our viewers about Pharmacy Week and what they things that they should know?
For me, go ahead, Ms. Hortence.
Okay. I would like to congratulate and all my staff who have been behind the scenes of from Central Health Region. There in San Pedro, in Matron Roberts, in Port, in Ladyville, in Kikaka, who have been on outreach programs out there. In our community pharmacies out there. I know we're from Ministry of Health, but we also have our pharmacists in our community. And even during the pandemic, we have our pharmacists, students who have been still going on to further their education in getting the bachelor program, because we have now, UB have now offered the bachelor programs, and this is the third cohort. So for those pharmacists who, with all this pandemic, with all the extra workload, and still have the time to continue with their education, congrats to you all. For those who have finished, congrats also. And I would just like to wish you all a happy Pharmacy Day.
Mm-hmm. All right.
I also would like to salute my team at San Ignacio Hospital, all pharmacists, pharmacy assistants as well. I like to salute my colleagues in the private sector, all community pharmacists and all pharmacists countrywide. For us to continue doing our job, I know sometimes it is a bit frustrating when we don't get recognized, but like I say, it is not a competition. They're complementary roles that we have. And as long as we know that we are doing what is best for the patient, that should be our satisfaction. But I would also like to urge everyone and leave with this message that please, if you have the opportunity to vaccinate, please get the vaccine. And that's for the entire country of Belize, because we know that vaccine saves lives.
Yeah. All right. Well, happy Pharmacist Day in advance. And we do, of course, want to extend that to all the pharmacists across the country. Thank you for helping us understand more about the work that you have been doing, and continue to stay safe, and thank you for what you do.
Thank you for having us on the show.
All right.
Thank you.
And with that, we're going to go ahead and take a break. When we come back, we're going to be talking about the job opportunities that exist at Transparent BPO. So please stay tuned.
This COVID update was brought to you by Hortence Systems, your technology center, where you'll come for the price, but stay for the service.